Hello everyone, I hope you are doing great. Welcome to DrBoms YouTube channel, your number one holistic and health channel. Today we'll be talking about another very interesting topic, and it's no other than autism. I'm sure we all have been hearing about autism, but today we'll get to know more about autism as we are creating awareness. So please like, subscribe DrBoms, and also invite family and friends to also like and subscribe DrBoms YouTube channel. Please share whatever health information you get on this channel with family and friends, as they do not know who it can be of help to, as well as share with your colleagues, neighbors, and everyone who you have contact with, because you may just be saving someone's life. So today we'll be talking about autism. I'm sure a lot of us have been wanting to know what autism is and what is involved. How do babies get it? How can it be prevented? What can be done, and management, and all what's a lot of questions on our minds. So we'll be discussing it in a moment. So Autism Spectrum Disorder is a neurological and developmental condition that affects how a person interacts, how a person communicates and processes the world around them. It is called a spectrum disorder because symptoms and severity vary widely from person to person. What are the key characteristics of autism? 1. Social challenges. Autistic children have social challenges, which include difficulty making eye contact, understanding emotions, or engaging in conversations. Secondly, communication differences. Some of these children have what we call delayed speech, limited verbal skills, or preferences for non-verbal communication. Another key characteristic of autism is repetitive behavior, hand flapping, rocking, or strict routines. They can also have what we call sensory sensitivities, that's having strong reactions to light, to sound, to touch, or textures. Some of them, however, have unique strengths. That includes having strong memory. Some of these children are very creative. They have strong memory, they have deep focus on their interests, or even advanced problem solving skills, like I already said. These children are gifted. So when a child has autism, it doesn't mean that it is the end of the world for the family or that child. There's still hope for such a child. So what are the common possible causes of autism? Number 1 includes the fact that autism runs in families, so it can be genetic. So a family where some members have autism, Other babies are at risk of developing autism as well. Brain development issues because of the differences in brain structure and function. Autism too can arise. And then we move over to environmental factors. For instance, children that are born premature, as well as parental age. The age of a parent can also affect the child, as well as prenatal exposures. So all these things can also affect or be a risk factor for autism. So that's why it's important when a woman is pregnant, or even youths, be careful what you are exposed to, whether x-rays and things like that, radiations, bomb blasts and things like that. You have to be careful, even to drugs and to things you just exposed to. This can affect your child's health in the coming future. So we must all be very, very careful not to allow all these things affect, negative things affect our children's health, as well as our health. So I'm sure a lot of us have been asking, so can this autism be cured? Unfortunately, the answer for now is no. Why we say for now is because we all know that science is evolving. Today, there is no cure yet, but tomorrow, who knows, there can be a cure. So all hope is not lost. So we should keep hoping and believing, because someday, somehow, there will be a cure for autism. So at the moment, it's only managed. So that is where we are right now. So autism is not a disease that can be cured, but early intervention, therapy and support help these children, help these individuals lead fulfilling lives. Like I said, a child being diagnosed with autism is not the end of the world for that child or his or her parents. There's still hope for a beautiful future for that family as well as the child. Please, if you know anyone with autism, drop a comment below on their experiences, as this might help someone. So we move over to the second session on how to detect autism in pregnancy. One is through genetic testing and family history. Like I already said, that if autism runs in a family, other members are likely to develop autism. Other members of that family are likely to develop autism. So if a parent or sibling has autism, the baby being carried at the moment in the womb, such children are at higher risk of developing autism. So advanced genetic screening can detect mutations linked to autism, such as in SHANK3, CHD8, and ROXN1 genes. So these are advanced form of genetic screening that can help detect mutations that are linked to autism. So we move over to ultrasound and brain imaging. Some studies have suggested that enlarged brain structures or abnormal brain development in the fetus could also be an indication that that child is at risk of developing autism. So then MRI scans in late pregnancy have also shown differences in cortical folding and brain volume in babies who later develop autism. So MRI scans in late pregnancy can also be useful in detecting the risks of a child having autism. Some people can also do what we call amniotic fluid testing. That's where they have high levels of testosterone in the amniotic fluid. Is that this high levels of testosterone in amniotic fluid has been linked to a greater chance of autism, especially in boys. So using amniotic fluid testing, you can also detect autism in a child. Then, researchers believe prenatal hormone exposure may influence brain development as well. So, all this still boils down to the fact that amniotic fluid testing can be done to detect autism. Maternal health factors. So, certain pregnancy complications can increase the risk of autism. Certain pregnancy complications can increase a person's risk of developing autism, and this includes gestational diabetes. These are all pregnancy risks. Gestational, a mother who is having gestational diabetes is at risk too of the baby having, can increase gestational diabetes on its own, can increase the risk of the baby having autism, as well as high blood pressure, that's preeclampsia, for example, can also be a risk factor for a baby to develop autism, as well as severe infections during pregnancy. And that is why it's advised when you go to the hospital, you do the test you are asked to do during pregnancy, during your antenatal, so that when these checks are done early enough, early intervention can be done. And exposure to toxins or heavy chemicals, like I said, we should be careful what we expose ourselves to, as these are all risk factors for autism. Placenta abnormalities as well. Studies have suggested that irregularities in placenta development might be linked to autism risks. When there is an irregularity in placenta development, it can be linked to autism. So a thicker placenta with abnormal cell growth could indicate developmental issues. So that's why it's good to also, during scan, the placenta is examined for any form of abnormalities, as this can also give a clue or a guide that can suggest issues that can be linked to autism risks. Then we move to fetal movement patterns. For instance, some researchers believe that unusual or reduced fetal movement can be an early sign of neurological differences. These are all signs, these are all little things that can help someone to be able to know that yes, the baby is at risk of having autism. However, this is still under study and not a reliable diagnostic tool yet. So we must note that. So now, can autism be 100% diagnosed before birth? Unfortunately, the answer is no. These tests we have mentioned and risk factors can only indicate a higher likelihood, but they do not confirm that this person has autism. Diagnosis is only possible after a child is born, after birth, based on behavioral and developmental signs. Like I said, it is just, all this is just for now. A time will come, I believe, where autism can be properly investigated even before the child is born in utero. And I believe that will make management of that fetus much better even before the baby is born. Please subscribe. Like I said, click on the subscribe button. Subscribe. If you are finding this information useful, please hit the subscribe button and turn on notifications as we bring science-packed health insights that matter to every one of us. So we move over to the third section: autism development after birth. So what are the early signs? So between the 6th to 7th month of the child, we have mentioned some of these things. The parents or caregiver will notice that there's lack of eye contact, no response to name, repetitive movements, hand flapping, rocking, as well as delayed speech or language regression. Other early signs in toddlers and beyond also include difficulty in social interaction. Such children don't really like to play with other children or people. They always like to be by themselves. They have issues with making eye contact with people. No response to name. When you call such a child, they find it difficult responding to you. Don't get angry that the child is disrespecting you or the child didn't greet you. The child may be suffering from autism and needs better attention and care and management so that it doesn't become worse, or the child's situation doesn't get to a stage where it can become suicidal. So we have to be very observant as parents, as caregivers, not to allow our emotions control us. We must be sensitive to the children we have around us and see better ways we can help manage them. So some of these children also have hypersensitivity to sounds, lights, and textures. Intense focus on specific interests. They are usually very focused children, like I said earlier on. So we move over to the fourth section: autism demographics and global prevalence. So highest autism rates now in the United States, 1 in 36 children. This is as at 2023, that every 1 in 36 children in the US has autism. So it's something that the United States needs to really look into and find ways of managing and providing for these children so that they are not left behind. In Japan and South Korea, higher prevalence also due to advanced diagnosis. However, in Nigeria and India, there's lower diagnosed cases, but experts believe underreporting is a major factor. So meaning that we can have a lot of them. The prevalence too can be high here, can be high here in Nigeria. It's just that the diagnosis is not really so much. You just have fewer diagnosed cases. So as the diagnosis improves, as more persons go into the field, I believe the actual numbers of these cases in the country will be detected. So who is more likely to be diagnosed? Boys are 4 times more likely than girls. Science is yet to still know why that is the case, but at the moment, that is what it is. In girls, symptoms may be more subtle, leading to underdiagnosis. And then we move over to section 5, prevention, management and control. Parents, so I'm sure a lot of parents have asked that, so can this autism be prevented? Presently, there is no definitive prevention, but reducing the risk factors helps. And what are these? So during antenatal, take your folic acid intake seriously. When pregnant, or if you know someone who is pregnant, you encourage the person to take their routine antenatal drugs regularly and take it serious. Don't joke, because someone's life it can be affected negatively if you joke with your routine drugs as a pregnant woman. Avoid harmful chemicals during pregnancy. Be careful what you drink. Be careful what you expose yourself to as a pregnant woman. If you are the type that smokes and all that, take alcohol, you have to stop that. Why? Because you are pregnant. Instead of, so that you will not have an issue, a child that you will now be worried about when born. So also managing parental stress during pregnancy. You try not to allow yourself to be so stressed, because any little thing can affect your baby and your own overall health. So you must try as mothers, even as husbands, to support your wives during pregnancy to reduce stress and all of that, so that you have a healthy baby being born out from a healthy mother. Management and therapy. Early intervention is key. The earlier therapy begins, the better the outcome. The earlier therapy begins, like I said, that's why as a person you must be sensitive to children around you, because some parents have these autistic children but they don't know, because they are not aware that there's a condition called autism. And that's why we are doing this video, to create awareness for persons, for parents, for people who do not know that there's autism or there's a condition called autism, so that these children the diagnosis can be made on time, as early intervention is key and it will help in managing these children. So the earlier therapy begins, the better the outcome. Applied behavior analysis also helps with learning social skills. So those children, you don't leave them alone because they are not able to interact with people, so you now forget about them. No, you have to help them with learning social skills. Then speech and occupational therapy for better communication. All these are forms of therapy that will help these children. So parental and community support. Everybody, like we all know, in Africa, the training of a child is not by only the parents, it's a community matter. You don't leave the grooming of a child, the training of a child to just the parents or the family of that child. No, it's something that everyone is supposed to be involved in, because when a child is good, it's a blessing to us all. So parenting an autistic child requires patience and education, both from the teachers, the parents, the siblings, everyone who knows a child who is autistic. You have to be patient with those children, and you have to show them love. They are also children like every other child you know. Schools and workplaces should promote inclusion. Those children with autism should not be isolated, please. They are also human beings like every one of us and deserve our love and respect. Government support and health policies need to improve also in a lot of countries. As the awareness of autism increases, the government have to also come in to support these children with health policies and other ways to improve the life, the outcome of these children, their life expectancy of these children and all of that. So once again, I believe you found this video educative and very informative. Please subscribe and share. Also invite friends and family to DrBoms YouTube channel. Let them also subscribe. Your colleagues, your neighbors, inform them that something is happening on DrBoms YouTube channel. You get your health topics for free. You are well informed. We keep you up to date. We give you information that will help your life and that of your loved ones. So we keep you up to date with very beautiful health topics that you'll be glad you listened to. So autism is not a disability. It's a different ability. We must know that autism is not a disability. It is a different ability. Early detection and intervention change the life of these children. Let's spread awareness and fight the stigma. Please, no child with autism should be stigmatized. Let's keep telling people, spread the awareness as you have listened. Let people know that there's something called autism, that children have a condition called autism, and these are some of the things we can do for such children. So, what are your thoughts on autism awareness? Please drop your comments in the comment box, and don't forget to share this video. It might help a family in need. Thank you very much for listening. Stay empowered, stay informed, and enjoy the rest of your day. Thank you.